Hello friends, let us now learn some important points about brain injury. We have primary brain injury and secondary brain injury. Primary brain injury, in this the neural damage is attributed directly to traumatic insult itself. This includes shearing of neuronal axons, contusions or lacerations, or diffuse axonal injury. Secondary, it occurs after some time and it is preventable. Causes includes that means it occurs after. It does not occur directly due to trauma, but these occurs due to consequences of trauma. For example, the causes include hypoxia, hypotension, increased intracranial pressure, decreased cerebral perfusion pressure, and pyrexia. So in this, due to the trauma, there is first primary brain injury has occurred. So due to the trauma, along with this primary brain injury or without this primary brain injury also, there will be some changes that are occurring in our body, like hypoxia, hypotension, increased intracranial pressure, decreased cerebral perfusion pressure, pyrexia. Even some other changes can also occur. When these changes, these other changes, if these cause the brain injury, then we call it as secondary brain injury. First, we will learn about the contusions. Contusions are temporary neuronal dysfunction following non-penetrating trauma. So in contusions, non-contrast CT is normal and deficits resolve over minutes to hours. Second type is contusion. Contusion includes cerebral contusion. This cerebral contusion mainly occurs due to acceleration and deceleration injury. If contusion occurs at the site of impact, then it is called as croup injury, and if this contusion occurs opposite to the site of impact, then we call it as counter coup injury. This counter coup injury is mainly due to the inertia of brain which is contacting onto the skull. See, this contusion most commonly affects the inferior frontal bone and the temporal bone. Hemorrhage and tissue edema can occur in the brain parenchyma. So if we see the investigation of choice of contusion, this includes non-contrast CT scan. Treatment is, first and foremost, we should decrease the intracranial pressure. For that, we can use medical measures like mannitol, which is generally given, or we can do surgery. Surgery is actually rarely required, and in surgery so whenever there is intracranial pressure, increased intracranial pressure, first and foremost we prefer medical management, and we will delay surgery as far as possible. So this is about brain injury. Thank you for watching.